All right. So every day at MSF, we save children's lives, but surviving is only the beginning of their journey. In our wards, we see children who no longer play. They flinch at sudden sounds, and they withdraw from touch. Their bodies recover, but their sense of safety does not. Play is essential for a child's well-being. It supports healthy physical, cognitive, linguistic, and socio-emotional development. After trauma, play provides a safe way for children to process experiences, to reduce stress, rebuild a sense of trust, mastery, and confidence. At MSF, we understand that medical care and psychosocial care go hand in hand. Healing the body and restoring emotional safety are inseparable. In conflict and crisis, play might seem inconsequential, yet it's often the first step towards healing for children and their caregivers. Breaking news. Play therapy is not an add-on, it's essential pediatric care. The need and why integration matters. A child's recovery depends as much on how we deliver care as what we deliver. And across MSF projects, many children are raised in crisis environments. Exposure to displacement, violence, and instability disrupts attachment and development for children, altering how a child's brain develops, how they manage stress and relationships. When these children enter our hospitals and our wards, the unfamiliar sights and routines can unintentionally re-traumatize them. When integrated play therapy as part of broader psychosocial care can address this. Embedding play and connection in daily routines creates a foundation for physical and psychosocial well-being, and treatment spaces become environments of care, connection, and hope. All right, here we go. Thank you. Play as therapy, and most importantly, trauma-informed play therapy. At MSF, play therapy is grounded in the principles of a trauma-informed care. We're talking about safety, trust, empowerment, choice, and collaboration, all of those elements being essential to their care, providing small, consistent moments where children can regulate their emotions, express fear, and most importantly, regain agency. When integrated into psychosocial care, play therapy strengthens attachment, improves cooperation during procedures, and fosters resilience both for children and their caregivers. This has been demonstrated in research and field experience. Integration in action. We have a pilot project that happened in MSF Kenema, Sierra Leone, and I'm going to let the next video speak for itself.
My name is Karim Usman Kenawa, the mental health supervisor in Ehanga Hospital, Kenema, Sierra Leone. In Kenema, Sierra Leone, many children arrive at MSF Paediatric and Nutrition Ward with more than medical needs. They come with fear, stress, and the weight of crisis. Before play therapy, many struggle to sleep, eat, or cooperate with treatment. Caregivers often felt overwhelmed and unsure how to comfort them. In 2022, MSF introduced a new approach, bringing play into the heart of pediatric care. Play specialist Catherine trained the first local play counselors and helped create the MSF Play Therapy Toolkit. Today, play therapy is part of every life in Kenema. Through movement, music, drawing, storytelling, and quiet moments of connection, children release stress, express feelings, and feel safe again. These sessions don't just change the atmosphere, they change outcomes. Counselors have supported more than 23,000 children, helping them feel calmer, more confident, and more engaged in their care. As play counselor Kemo Kabu says, through play, our patients recover faster and our world feels lighter.
Thank you. So, Kinema shows this is a pilot project and 2 platform, and it shows that healing is available through play, and the evidence is clear. Play therapy works at MSF, and integration is the next step. We have developed a play therapy toolkit, co-developed by MSF Sweden Innovation Unit and the OCB. It's a practical, field-friendly tool designed for MSF context specifically, and it's inclusive of play therapy concepts, therapeutic and developmental activities, low-resource toy-making instruction, trauma-informed practice guidance, play space setup checklists, and case examples from MSF sites and missions. And most importantly, it's grounded on the UN Convention of the Rights of the Child, Article 31, which states that every child has the right to play, even in crisis settings. Your call to action today is to learn, adapt, and advocate. Explore our play therapy toolkit. Embed play therapy into pediatric and MHPSS context whenever possible to help children connect, reconnect, and recover, and be an advocate, be a champion for trauma-informed rights-based care at every level of MSF practice. The right to play is the right to heal. These QR codes will lead you to our SIU website, and they also will lead you to a downloadable play therapy toolkit. And even small, structured moments of play can make a meaningful difference in crisis settings, and I thank you for your time today.